Deborah and Candace, are you going sequentially or as a team like our Hair H1E team? I'm going to let you guys do this how you'd like, and we can.
My son's actually come first, even though Deb's listed first in the program. So I'm Candace Young.
And then you can let us know if you want to do questions in the middle or at the end.
We'll do questions together at the end. Perfect. Yeah, thank you. So I just want to thank everyone for, I think Deb and I are both really honored to be here today, and want to thank the committee especially for investigating what some of the particular challenges are in small retail venues, because it is very, very different than a supermarket environment. So I just wanted to also, oh, I guess I'm in charge of this here. Okay. Talk for 1 minute about the Food Trust and our approach. I think most of the speakers today are really from academic institutions. And Deb and I are both with the Food Trust. The Food Trust was founded in 1992 and has started doing food access work in communities way before it sort of became part of even academic research or part of almost the daily conversation about the food landscape that we see in our neighborhoods. And our mission is to ensure that everyone has access to affordable and nutritious food, as well as information to make healthy decisions. And this is just an image that is meant to be a graphic sort of visual representation of our comprehensive approach. Today we're mostly focusing on this area here, which is where people shop and whether that's in a corner store, a convenience store, a supermarket, a farmer's market, or elsewhere. But we also see that as a much larger picture of also an environment where people learn. We do SNAP education in community settings and in schools, how food is grown and how it's distributed, and Deb will be focusing on that part of the conversation. And then also that food is a part of our daily lives and how people, not just corner stores, but in general, how food is a part of every settings in people's lives, in their daily lives, the exposure that they get to food. So I want to take everybody from, just to a quick trip into what a typical corner store looks like in Philadelphia, and talk a little bit about our work. This is really a typical corner store in Philadelphia. So this is going to represent primarily an urban type of environment. The neighborhoods where we do a lot of our programming are some of the census tracts with the highest rates of poverty in the country. So these are all low-income communities. 85% of our stores accept SNAP, 45% accept WIC. So that to me is an indication that there are a lot of barriers to stores even being able to accept WIC around the stocking requirements, or that there's a perception that people wouldn't come in and buy their WIC package there if it were accepted. So I just want, if you think about the store environment, Jen did a really great job of laying out sort of how we define what a corner store is. In general, our corner stores have one cash register, if they even have a cash register. A lot of times it's just an adding machine. It's usually got 2 or 3 aisles. It's 800 to 1,000 square feet. So it's a very, very small and high density type of shopping environment. There's, as you can see here, did you notice that there is actually some WIC signage here and here? However, it really gets lost among the tobacco advertising, which is often placed in very, very prominent areas. And that's, I think, one overall challenge. I'm presenting sort of the exterior part of a corner store to start, and then we'll move to the interior. But in terms of a food environment, what you see is that, things like lottery and cigarettes, and here's another lottery, the placement of those ads and even the placement of the products within the store are a big source of income for store owners. And so I think it's something to keep in mind in terms of if we want more retailers to promote WIC products, that's the model that a corner store owner is used to. And with the small profit margins that they operate off of, receiving monthly amounts of money for the placement of products within the store as well as advertising outside the store is, that's the model. So we might want to consider, something to encourage placement inside the store or outside the store and to help the store owners with that. This is now the environment that we're dealing with inside the store. Many of these businesses are, operate at very, very small profit margins. They're all independently owned and operated. And we work with a network of over 600 stores. I think if we included all of our staff on the ground, we've spent thousands of hours in corner store environments, educating and training store owners and just sort of informally talking with customers while we're there. The majority of them in our corner stores, it's primarily Dominican is the ethnic group that runs a lot of the stores. It's about 80% are Hispanic or Spanish speaking of the owners I'm talking about here. And so I was really glad to see some of the data about Hispanics having a higher odds of actually redeeming the cash value vouchers for fresh product, because I think many of the owners do come from that environment in their home model of the stores and the fresh fruits and vegetables that they were exposed to growing up. So, I guess I'm here to present sort of about the formative research that we've done and the observations that we've seen. And one of the things that, we think is that they are familiar with fruits and vegetables, but the model in the US of a corner store looks much more like this. And so you can see it's very high density. You have multiple different product categories all kind of jammed into one area. So you've got household goods here, like dishwasher detergent and a laundry detergent, toilet paper here, the cooler with the beverages here. This here, you can barely see it, but that's some of our marketing of healthier beverages. We do marketing and shelf labeling. Then you've got, grains and products here, snack products right here at the entrance, tobacco advertising here, and then here's the one lone wick sign there. So to kind of summarize, in one area, the challenges of working in small retail environments, and then the opportunities, because we like to think if there's a challenge out there, it also presents an opportunity for improving healthy food access. So the main one, and I think Jen and I did not share slides ahead of time, but these things on this list are the same ones that she had on her slide. So that was great validity there, from independent samples. So the limited infrastructure, again, many times the refrigeration that they do have is, beverage companies will actually pay for the refrigerators to be placed in the store. So many of our stores, when we first started working with them and expanding our program in 2010, had refrigerated cases but did not have any refrigeration that was for fruits and vegetables. It was for the beverage cases that had the marketing for the beverages at the top. So one of the things that we did was we did some conversions in the stores and actually provided refrigeration to about 100 stores. The other thing that we did was training and technical assistance, and we have a Cell Healthy guide that has been the base of our training. A lot of it is focused on carrying fruits and vegetables, making that a part of their business, reducing wastage by doing added value products, by marketing and keeping the products together, and strategies such as that. Then the other challenge is marketing unhealthy products. As you saw from the photos, there's a tremendous amount of marketing around unhealthy products, and the majority of customers are going into a corner store for, picking up cigarettes and lottery tickets. So that is a cultural norm, that's the social norm right now for how the store is used. So we really see this as, I know a lot of, what Dr. Dolehite was presenting was looking at impact over 3 months or 6 months. We really think that in terms of working with small retailers, we have to shift social norms, and that can actually take years and years. So we're in this for the long haul, even though we know it's a very challenging environment. We also know that the majority of shoppers shop there daily. So the exposure is much higher than the exposure, for example, in a supermarket or in a farmer's market. So while at a farmer's market or a supermarket, you do get exposed to more fruits and vegetables, if you're exposed to a corner store environment daily and you go there that often, changing the environment there, it's a good investment for us, and we still are committed to working with corner stores. And so then what we do is, we do examples, we do a lot of marketing of the healthier choices, and we try to work on placement and promotion of healthier items. The other challenge is just this lack of demand. We do a lot of community education. We have a program called Heart Smarts where we actually I think there's a lot of research around using community venues for health promotion. And so the Food Trust is pioneering programming where we actually are partnering with a healthcare provider to do blood pressure screenings and to provide heart healthy information in our corner stores. And so we've actually seen the research in that is actually in the works, but we have seen an improvement in following up with your healthcare provider, if we know from blood pressure screenings from that work. And then finally, the supplier gap, and Deb is going to focus her comments on that and some of the pilot work that we're developing and research that we've done on some of the novel distribution networks that can be done to reduce some of these barriers. So this is an example of the refrigeration unit here that we distributed to corner store owners. And you can see that it's rather small, but eat fresh, feel good is one of our catch marketing phrases there. And it's rather small. It's meant to fit within a small retail footprint. This is an example of our POP displays, or point of purchase displays, that is connected with our Heart Smarts programming that we're doing. And it's an example of where you can bring together products from different categories and have them all together so that it makes the experience for the customer a lot more convenient and easier, so that you don't have some of the challenges that Dr. Racine talked about, where they're looking for different products all over the place and then they get to the register and not accepted. It would be, this is a placement strategy that we've used, and that's been really successful. And this is where we actually do education. You can see there's recipes here, and then our educator is often here with just a small table in this environment. Then lastly, I just wanted to talk about a project that I did. One of the things that I think is missing from the small retail piece is actually the perspective of store owners themselves. What we do see is there's a lot of research on the end of, did behavior change, did availability and accessibility change in the store environment? But not that many people have actually talked to the retailers. And again, this is an area for future research where we could even do a little bit more research to talk to them about some of the barriers to WIC specifically. But we did a project with some collaborators at UPenn where we actually did qualitative research, qualitative interviews with store owners, just in general about our program. And we weren't prompting them specifically about WIC or talking about that. We were just trying to understand the impact of our program. But you can see that WIC and sometimes WIC and SNAP both emerged as a major theme because retailers rely on income from SNAP and WIC for their businesses. In a community where 80 to 90% of the people are actually on SNAP, this is a big part of their business. So the nice thing, there was just, I think, a happy accident, which was that we were giving away refrigerators between 2010 and 2012 with support from the Philadelphia Health Department and their Get Healthy Philly initiative for store owners that were really engaged in the program right at the time that the new WIC guidelines were taking effect, which suddenly required fresh fruits and vegetables to be carried by WIC retailers. So you can see that just from these quotes, for WIC customers, it's good because since they get vouchers for fruits and vegetables, and those are always available here, I always have fresh fruits. It has benefited WIC customers a lot. The refrigerator gives good results because people buy fruit. It sells a lot with WIC customers as well. They take a bag of fruits. And then finally, we are also with WIC. They get a check for vegetables and fruit. So all those things that they need, a lot of customers get them from the WIC check. So they get a head of lettuce, or they get tomatoes, and they get some bananas, and they like that because some stores, they don't have the space or they don't have the equipment. So they might have some, but if you have an actual cooler where you can use it just for that, for WIC, you can have everything together so it works together hand in hand. And so you can see that there was just a natural evolution between, we didn't have them put their WIC products together, but several of the store owners did things like this, like in the photo here, where they actually put yogurts and milk and eggs and fruits and vegetables, some of the juice items all together in the same cooler, and sometimes milk, so that it was just naturally from them that evolved as part of our work. So just one last note then is to think and encourage the committee to consider, there's sort of the 4 Ps or 5 Ps of marketing. And I think this is an area for WIC to really grow because you're reaching the right people, low-income audiences, women, infant, and children that are at greatest nutritional risk. You're working on pricing, on the right products. So you're expanding on the product inventory, the pricing, and the people. But I think from what we've heard from all the speakers today, the placement of those items and the promotion of them are 2 areas that I think we could really develop further to make the experience a more positive one for customers, WIC customers, and their families, as well as for some of the retail environments. And now I'll pass it on to Deb, who can talk about some of the distribution issues. Thanks. Good afternoon. Okay, so Candace just went through a bunch of ways in which we provide training and technical assistance to store owners, but I think we all know, and it came up earlier, that unless food can actually get to stores in a way that's cost-effective and efficient and doesn't raise the bottom line, which ultimately raises prices for customers, we're kind of in a difficult position. So as we think about feasibility and business sustainability, I'm just going to talk for a few minutes about distribution. We had the opportunity to dig in a little bit around small store distribution last year with some support from the Robert Wood Johnson Foundation. We did a national scan. We engaged about 50 to 80 stakeholders through interviews, and then we had a convening last fall where we brought together store owners, wholesalers, distributors, public health experts, and other industry professionals to talk about closing some of these distribution gaps. Jennifer gave, basically the rundown of what we think about as small stores. Candace focused in on bodegas for the purposes of what we looked at. We considered all of these because it really captures urban, rural, and suburban places that folks shop for groceries at one point or another during their week. And there's 4 main ways that we like to think about the way that small stores get food into their stores. So, we're all probably more familiar with the way a supermarket or a large grocery store might receive deliveries, right? They've got a large truck coming into their loading dock. They've made a really big purchase. They've got folks on hand in store to receive product, stock, and everything like that. It looks very different with small stores. Specialized distribution companies are one method. And these kinds of businesses cater directly to small stores. A good example might be dairy, but there's also some distributors that actually stock and deliver just with small stores in mind. But I want to say that generally speaking, those are pretty rare. Direct store delivery vendors, also called self-distributing manufacturers, these are sort of like, we consider these like the Frito-Lay truck, right? And the soda companies, that it doesn't really matter if the stores are making big deliveries. It's in their best interest to come in, to provide infrastructure, and to merchandise on behalf of the store. Typically, your direct store delivery vendor or your manufacturer who's delivering directly, that's the only direct delivery that a lot of small stores are getting. Then we also have what are called jobbers, and these are more common in high density areas, right? So cities like New York, DC, Philly, LA, Chicago. We have a lot of folks who are sort of like a man with a van. Highly entrepreneurial people in a neighborhood who think to themselves, well, this person needs a little bit over here. We need a little bit over there and a little bit over there. I'm going to go pick up product and deliver in a van to a bunch of these little stores on behalf of the store owners. Oftentimes, though, what we really see are operator-driven logistics, and what we mean by that is the store owner takes on the burden of picking up products themselves. And I think everybody today has alluded to just how difficult it is to run a small store, whether you're a rural grocer in southwestern Kansas, or you're a corner store owner here in DC. Small store owners are, their own accountants. They run they mop the floors, they run the registers, right? And they have to provide customer service at the same time. But typically when they go out, they're buying from, other supermarkets or Costco's. They also buy from produce terminal, like wholesale produce terminal markets. They also buy from other large wholesalers that do what we call cash and carry, where they can go in and they can buy, if they need it, a whole case of canned beans, but they could also buy by the each, so they have a lot of flexibility in what they get. This is very expensive though, right? Because it's time, it's money, it's back and forth in their car, in their van, or maybe they were relying on family members or friends to help out. But I just want to say, generally speaking, what a lot of small stores deal with is they're doing a mix of these things in order to get all of the products that they need. And this is also true for WIC authorized products. But there's gaps. So for some folks, this all works really well and they're happy. But for a lot of folks, they just don't have the purchasing power they wish they had to benefit their customers and to benefit their own bottom line. So what we have is a situation where the needs of these small store owners can really be at odds with conventional distribution systems. And as we talked to both distributors and store owners and other industry professionals when we were doing this research last year, the big thing that came up were these last mile inefficiencies. So if you think about your typical distributor who might offer a whole range of products, everything from paper goods, to bread, to fruits and vegetables, to toothpaste, right? These are your sort of typical broadline distributors. They spend lots and lots of time going down the highway. It's those last couple of miles that are extremely expensive when they get off the exit and they either have to sit through city traffic to make a small delivery. Maybe it's not much actual square footage in the truck, or they have to get off the highway and they're back on country roads dropping off these not very large deliveries to these stores that just don't have the purchasing power to take up more square footage in the trailer or things like that. So those last few miles are really expensive. So what distributors like are large orders so that it's worth their while to make these deliveries. And we just know that small stores just don't have that purchasing power. They either don't have the infrastructure or they don't have the turnover of goods. So really economy of scale issues. We already talked about infrastructure, so I'll skip over that. And also when we think about cost and loss leaders, we talk a lot about fresh fruits and vegetables and how much more we want to see about those, but because they're highly perishable, those tend to be, they can be really great money makers, but they also tend to be very expensive to store owners because the waste is so high. We also talked, with store owners a lot about consumer demand, and they definitely said, yeah, we're seeing trends. People do want to eat healthier products. But just as often folks said, they're not really interested, and I'm not really sure this is part of what I want to be doing. I understand that it's important, but I just don't see the demand yet. And I bring that up from the store operator perspective because what that means is they're not asking their suppliers for those products, right? So it's a cycle. You need to have the consumer demand, which trickles back to the store owner, going back to their supplier saying, I really, really want this whole grain spaghetti. Can you please get it for me? You haven't gotten it for me before. Let's figure this out. Or figuring out how to order whole cases of produce because there's enough consumer demand that there's enough turnover that they can make it worth it. So all of this can create a situation of a sort of negative feedback loop between suppliers and store owners, and everybody can kind of lose if things aren't going well. So if you've got a store owner going out and buying produce from Costco or a grocery store where they're not getting the best price, they might not be getting the best quality because they're buying things that have already been sitting on the shelves for a couple of days, those items aren't going to sell very well. There's going to be waste, there's going to be spoilage. They're going to be expensive for customers to buy. And nothing about the supply chain has really changed, right? Customers might have a poor perception of quality, whether that's accurate or not, and we just don't have good access to healthy food. You've got store owners who are losing money, suppliers that aren't really changing what they're doing, customers are still unhappy, but this is the part where we get to talk about some great models that are emerging and addressing some of these challenges because it's not all completely bleak, I promise. Okay, the first case study that I wanted to present is with Jetro Cash and Carry and Mango Grocery and Meat. Jetro is a northeastern and mid-Atlantic company that is a wholesaler that does not provide delivery. They don't do their own logistics. So if you were a store owner or maybe if you ran a restaurant or something like that, you'd be a member of this store, you'd walk in and you'd pick up the boxes or cases of things that you need. They're in retail-ready sizes, things like that. Jetro, we know firsthand in Philly, their store, and we've been to their location in the Bronx as well. They do a great job marking everything that's WIC authorized in their store, so it's really easy for store owners to go in and know exactly what they need to pick to fulfill their requirements. But more than that, they've partnered more closely. The Bronx location has partnered really closely with stores, and in particular Mango Grocery and Meat, to provide additional training and technical assistance. And this is a win-win on both ends, because what you have is a wholesaler who's willing to go out to the store and provide merchandising and marketing expertise to the store owner, tell them a little bit about how to store their perishables better so that they experience less waste. And then you have real buy-in from the store owner to continue to go back to Jetro. So, really a partnership type model where everybody benefits. The second case study I wanted to highlight in particular is with Chester's Thriftway, which is in John Day, Oregon, in an extremely rural part of Oregon. And this is a situation where this is a slightly larger grocer, but rural grocers can be really, really isolated, whether it's a country store or whether it's a store that maybe even has 8 to 10 aisles. And I don't always like to point the finger at Walmart, but a lot has really happened to these family-owned companies that were up and running for 20 or 30 years across a couple generations, and then these superstores move in and they take all the business away, right? So Chester's is an example of a store that suffered a little bit over the years, but made some really interesting changes to the way that they were purchasing and serving their community. So what they wanted to do was increase the amount of deliveries they received every week, particularly for produce. They knew that there was more demand for produce, but they just didn't have the purchasing power and enough customers coming in for those products to turn over. And we all know what it looks like to walk into a grocery store and have one sad bell pepper on the shelf, or things just aren't looking great, right? So what they decided to do, they sort of started by talking with their produce distributor and said, how much do I need to buy for you to come and drop off 2 times a week or 3 times a week? They figured all that out. And then Chester said, you know what? We're going to buy on behalf of some other stores, you know, in our general region. And I think you had a question just about that very model, and that's happening in urban settings as well. But this was particularly compelling to me because it's rural, and these stores aren't actually all that close together. But they really saw the business opportunity to do that on the other half of stores, because as we were all talking about, different stores serve different purposes. So you might think that these stores are in competition with one another, but in fact, people shop all over the place when they've limited access. So this is a situation that worked out really great for Chester's. They were able to start to get some rebates and discounts from their produce supplier, and ultimately, provide fresher, healthier, better-looking product to their customers. And then the last case study I just wanted to take a minute to talk about, or an extra minute, I should say, is a little near and dear to us. The Food Trust has been working closely for the past couple of years with several partners in New Jersey to support changes to WIC stocking requirements. So in June of 2014, New Jersey WIC instituted a policy change requiring all WIC authorized stores to stock more fresh fruits and vegetables. We've already talked about what some of those challenges could look like. So that minimum includes 2 fresh fruits and 2 fresh vegetables. In the past, they could meet the vegetable requirement with frozen or canned. So to support the new requirement, particularly for small stores, the New Jersey Department of Health and the Food Trust partnered to create an opportunity to train vendors to sell healthy foods at the same time. So the timing was really right to do sort of a sweeping training around healthy food, or sort of a healthy small store program implementation, because New Jersey was already going to be busy retraining WIC vendors on these new stocking requirements. So building on mandatory vendor trainings that were already happening, the Food Trust plugged in and did some training modules around healthy foods and how to stock and things of that nature. During the course of the 2014-2015 year that we did this, the Food Trust and the Department of Health hosted 21 trainings that reached 900 WIC authorized vendors, about 350 of which were small stores. So we focused on selecting healthy product inventory, buying and handling fresh produce, pricing and promotion, in-store marketing, and things like that. And we took a survey of all of these folks at the end of the day and asked them, what else do you want to know? What didn't we cover? What is it that you need? And most importantly, are you interested in possibly participating in a Healthy Corner store network across the state? And we got really, really great response. A total of 197 WIC authorized stores expressed interest in learning more or receiving additional TA, and we've been able to do just that. So since that time, we have continued our work doing trainings and working one-on-one with WIC authorized stores in New Jersey, and hope to continue this work into the future. Right now, we're working closely with about 40 stores in New Jersey, and just to be able to comply with the new WIC fresh fruit and vegetable requirements in a way that is profitable and sustainable to them. At the end of the day, we always really like to work with our store owners around what's profitable to them, because if it's not supporting their bottom line, they're just not going to participate. So as a part of this network, we continue to look at infrastructure for stores, and we evaluate the needs of store owners. So quick before and after picture, you can see this is a reach-in refrigerator that looks a little sparse. And afterwards, stocked with, there's some additional signage and some nice baskets for marketing. This is just one of many stores we worked with. And then, just going back to the distribution work that we did, we just came up with a bunch of sort of general recommendations around some things that would continue to support store owners and suppliers, right? We want to consider both ends of the supply chain when we think about stocking healthy foods and WIC authorized foods. So additional research, consumer demand. What exactly do people want to buy? What are their shopping patterns? Store owners want to know this, and so I really enjoyed Dr. Tong's and Dr. Zhang's presentation, because they really drilled down. They said, this is exactly what people want to buy, and store owners really want to know that. Importantly, they also really want to understand, if I implement some sort of, let's say I become a WIC authorized vendor, or I start stocking healthier foods, how long does it take me to become profitable? Because they're taking a big risk. Is it 30 days, 60 days, 90 days? These are things folks want to know. There's, policy levers at the local, state, and federal level, everything around, thinking about food tax on the state level, to whether cities or municipalities can offer tax breaks or other incentives to stores to change the way that they stock, to thinking about, ways that corporations can better support small stores. We've all been talking a lot about whether or not items are marketed really well in grocery stores. Some distributors provide great marketing materials for supermarkets, but they don't necessarily do it for small stores. So how can we sort of change that dynamic? And the need for additional capacity building as well. So more training, great networking opportunities is something that came up among store owners. They would love more of a platform to get together themselves with what little time they have to share their best practices. And making sure that a diverse stakeholder group stays engaged in the conversation. So public health professionals, suppliers, manufacturers, bringing everybody to the table to help solve some of these challenges. Okay, thanks.